Hello everyone, this is Professor TJ Land from the main campus at Grand Canyon University. Tonight we're going to talk about, or this week, we're going to talk about the 3 Nurse of the Future competencies that are communication, patient-centered care, and then the teamwork collaboration component. These are the last 3 that will complete our topics 6 through 10 for exam 3. The next presentation after this one will be exam 3 content review in preparation for your exam 3. Again, this is Professor Land, and this week is October the 19th to the 23rd. And again, we're going to talk about communication, patient-centered care, and teamwork collaboration. So please remember that communication requires you to have a feedback loop. In other words, we have to be able to share information, and then we have to be able to respond to, okay, so what went well, what didn't go well, how would you do something differently? Something else to consider is that, communication in a feedback loop actually works well when there's no stress. But I'm not sure that there's very many of us as nurses who can have a position that is not at least a little bit stressful. Just nursing in general is stressful. So it's something you have to consider. You have to recognize that when stress is added, perceptions start getting tangled up and perspective gets skewed. The only true communication is what is perceived by the receiver. So whatever the speaker is saying, if the receiver does not understand it, then true effective communication did not occur. One of the ways to kind of work on that is to, ask. Do you have any questions? Do you understand what I'm saying? Can you share with me what you heard so that I can make sure that I got everything that you needed across to you? So there's all kinds of ways for you to make sure that effective communication happens. When both people are under stress, it becomes even more complicated. And I can tell you in healthcare, that is typically a situation that will happen where both of the communicators are under stress. There's some styles of communication. There's a passive, there's aggressive, and then there's assertive. I will tell you that the passive are usually very timid. They're peacemakers. They are not accustomed to being winners. They actually ignore their own rights. They allow others to be first, allow others to make decisions for them. They are apologetic, inhibited, they avoid eye contact. But keep in mind that sometimes it's culture where they avoid eye contact rather than a passive communication style. Passive people have a very difficult time saying no. They make excuses so that they don't have to step up or come to the forefront. Typically, they have a soft, weak, wavering voice. Sometimes they ramble. They can be vague, fidgety. They can even make distracting gestures. Their goal is to avoid conflict at all costs. The other side of that pendulum is the aggressive communicator. This is the person who's competitive. They believe in the winners and the losers, and they expect to be the winners. They express themselves at the expense of others. So they are very dominating, very controlling. They can be manipulating. They have a tendency to try to make choices for others rather than just for themselves. They can be demanding, blaming, sarcastic. They can be using you language. They can get right up into your face or up into your personal space. They can use put-downs to help drive that they want you to consider what they have to say and not necessarily anyone else. And then, of course, The aggressive communicator has the ability to stir up guilt and resentment in others so that they are not challenged in the future. Their goal is winning, regardless of what the cost or the price is to others. The thing that works the best is kind of somewhere in the middle. This style is called the assertive communication style. This is done with respect for yourself and for others. You get to express yourself and stand up for yourself without violating the rights of others. Assertive people show calmness and confidence. They have a relaxed eye contact. They take responsibility for their own behaviors, feelings, and actions. They see and make a variety of choices, and they are open to negotiation and compromise. Their goal is to have an open, honest communication and have respect for self and others. So that's actually the one that we want to have as our ultimate goal. Silence Kills was a research situation that was done. I believe it was in like 2001 or 2 when they first started doing the research. And then they published the research and a book called Silence Kills, the 7 Crucial Conversations for Healthcare. And in the study, it was a national study of 1,700 healthcare providers and administrators. And that study concluded that it is a common practice for providers to say nothing when they observe some kind of troubling performance by their colleagues. 62% of nurses who see coworkers taking shortcuts that may endanger patient care, and 48% of nurses believe coworkers show poor clinical judgment. However, with these big numbers, there's still fewer than 10%, or there were fewer than 10% of the nurses, physicians, and other clinicians that felt comfortable enough to directly confront colleagues about their performance concerns. In that Silence Kills study, it was found that 77% of the nurses work with others who are condescending, insulting, or rude, and 33% stated that they worked with a few who were actually verbally abusive. These are under the disrespect column. Under the poor teamwork column, 88% of nurses have one or more teammates who gossip or are part of a clique that actually divides the team. In the study, it was asked, why would you not feel comfortable? Why would you not speak up regarding this information? And it was found that a lot of times people were afraid. They're worried about maybe I won't do it right, maybe there will be some retaliation, but there's fear. And then maybe we don't know how to do it so that it's a safe approach. And for some people, it was recognized that it just takes too much time and energy to get it done when you could just walk away and let them do what they want to about it. And that is definitely not the safest way, and that's not being a patient advocate. So the American Association of Critical Care Nurses was who the Silence Kills research was initiated with. And when that research was being done, it was when the American Association of Critical Care Nurses was actually promoting the standards of a healthy work environment. Nurses are to be as proficient in their communication skills as they are in their clinical skills. They need to focus on finding solutions and achieving desirable outcomes. They need to seek to protect and advance collaborative relations among their colleagues. Nurse communication skills mean that you invite and actually hear all relevant perspectives, and then demonstrate the congruence between words and actions, and then hold others accountable for the same. Nurses must be relentless in pursuing and fostering true collaboration. So if you have any other questions about communication, please do not hesitate to reach out to your faculty. The last thing I want to say about communication is that we need to have effective communication, and we need to have equal recognition of the speaker and the listener. There needs to be active listening, and what I mean by active listening is that the person who is listening to the other person speaking needs to be in the moment, rather than thinking about, oh, I got to go get groceries, I want to ask this question or whatever. You know, if you have questions or something, write it down. Don't interrupt the speaker, because they might answer your question in the very next sentence, but you will not be aware of that because you have been thinking about other things. So those are the kinds of things that you want to keep in mind to have effective communication. The last thing is that when you have communication with someone, their perception is really what the communication was about. So how do you ensure that your communication has been effective? One way is that if you are the communicator, you are making the statements, you can actually request the listener to, you can say something like, you know what, I want to make sure that I was very clear about what I wanted you to do and how I wanted you to do it. Can you share back with me what you think I said, just to make sure that we're both on the same page of music? And that's a good way to go about doing that. It shows respect, and it also shows that you know, you want to make sure that you're an effective communicator for the best benefit of the patients. So that actually gets our communication component done. So now what I want to talk about is patient-centered care. The patient. So let's talk about that for just a moment. Patient-centered care is our ninth topic in this course. Is all about. Preventative and health promotion is all about patient and family-centered care. It is actually the approach to plan, deliver, and evaluate health care grounded in a mutually beneficial partnership among patients, families, and the healthcare practitioners. It's founded on the understanding that the family plays the vital role in ensuring the health and well-being of patients of all ages. And the ultimate goal is that the patient and family-centered care will create partnerships and among the practitioners, the patients, the families, and that this is going to lead to best outcomes, enhancing the quality and safety of health care. So there's four core concepts with patient-centered, family-centered care. There's dignity and respect, information sharing, participation, and collaboration. So let's talk a little bit more about those individually. So under dignity and respect, as I said in communication, healthcare practitioners actually need to listen to and honor the patient and the family's perspectives and choices. Their point of view, you know, is probably the most significant point of view that needs to be considered. The patient and family's knowledge, values, beliefs, and cultural backgrounds are actually incorporated into the planning and the delivery of the care. That's just the appropriate thing to do. The next concept is information sharing. So healthcare practitioners communicate and share complete and unbiased information with patients and families in ways that are affirming and useful. Patients and families receive timely, complete, and accurate information in order to effectively participate in care and decision making. So this means that you need to be truthful, you need to be honest, you actually need to consider what you're going to say and then follow through on that. So the next component is participation. And this is the part that's really been difficult because for many, many years, patients were not allowed to participate. The healthcare providers told the patient what was wrong, what they had to do, and how often they had to do it without any input from the patient or the family. And so now we're having to re-educate people about the fact that it is their life. This is their health care, and we encourage and support their participation in that care and decision making, and we, at any level that they choose to participate. It depends on their comfort zone. Okay? So now let's talk about collaboration. This is where patients, families, and healthcare practitioners, and of course hospital leaders and organizations, we need to collaborate. We actually need to work together in policy and program development, implementation, and evaluation. So if we make a policy, we have a program, we implement that and evaluate that, we actually need to do that as a group, not individually. We actually need to work together in actually doing facility design. You know, if you're going to do an ICU design, it might be very beneficial to speak to ICU nurses who actually know what is needed in an environment like that, rather than just having a leader who knows nothing about it, who does not participate in that at all. Talking with the architect, and then, of course, when it's built, then there are major workflow issues that have to be considered. So actually having people work together in facility design is much more beneficial for patients and the practitioners. In professional education, it's just as important to collaborate in the education as it is in the actual delivery of the care. That part of that is we need to make sure that we are all discussing and acting on the same information. Our education needs to be the same. Our behaviors need to be the same. We should not be saying one thing for one group and something totally different for another group. Consistency and appropriateness is a big deal in healthcare. So we need to make sure that our delivery of care and our education are all consistent across the board. We don't tell one family this and another family this, something else. We need to make sure it's the same information, because it's not really, you're not going to build up trust if the husband goes and says, I heard this, and then the aunt goes and says, but I heard this. So it's like, okay, well, who do I believe? It's something we have to consider. Patient family-centered care. Well, why do we need it? Well, one of the biggest things is that our care has to be delivered by systems that are careful and conscientiously designed, providing care that is safe, effective, patient-centered, timely, efficient, and equitable. And if you will recall, those are actually, these are quotes from the Institute of Medicine's 2001 report, Crossing the Quality Chasm, that we talked about in our very first topic of this program. Our systems must be designed to serve the needs of the patients and to ensure that they are fully informed, that they retain control and participate in care delivery whenever possible, and they receive care that is respectful of their values and preferences. And again, these quotes come from that IOM report in 2001. So in that report, the Crossing the Quality Chasm, for care to be safe, we must avoid injuries to patients from care that's actually intended to help them rather than hurt them. To be effective, we need to be providing services based on scientific knowledge, evidence, to all who could benefit, and refrain from providing services to those not likely to benefit. Now this one gets pretty touchy here. So that means we should be giving appropriate care to those appropriate people in situations. Like if we have someone who does not want care, then we should not force care upon them. If we do have someone who does want care, we should not withhold that care based on our own opinions and thoughts. And that's kind of what doing something effectively, providing those services effectively and to the benefit of those who want it, rather than those who do not want it. Having it patient-centered. Well, this is where you actually have to provide respectful care that is responsive, to the individual's preferences, their needs, their values, and then ensuring that the patient's values help guide all of the clinical decisions that they have to make. We should not be pushing our own personal values onto others. For timely, this is where we actually need to start reducing waits and harmful delays for those who receive and even those of us who give care. We should not have extended waits and harmful delays. One of the things that was really harmful was the fact that ER wait times have gotten to be, anywhere from 10, 12 hours to days, depending on where you are and what kind of an environment you're in, what kind of community you're in. And so that's not going to be the most effective way to provide care. We need to do it timely, so that if we're going to save somebody's life, we need to do it in a timely manner so that we don't have more damage and more issues than we can actually deal with. Being efficient means that we need to avoid waste, in particular the waste of equipment, supplies, ideas, and energy. This is like, I'm not sure if you have already picked up on this in some of your clinicals, but one of the things you can think about is an isolation room, and they might have a wound that has to be cared for and the dressing changed once a shift. Well, if you go in and you take in like a stack of towels and a double stack of washcloths, and you take in like 6 boxes of gauze packs, and you take in like 7 Curlexes to be able to change the dressings, and they go home the next day. What happens to all of that equipment, all of those supplies that are actually in that room when they go home? They're a loss. The linens have to go into the laundry and be laundered. You can't put them back on the shelf. Same with the supplies. You cannot put them back on the shelf. They have to be discarded. And that's a lot of waste, and sometimes that is where the nurse's raise is coming from. So you need to be very efficient in the care and how you go about providing that care for patients. Equitable. This means that we need to provide care that does not vary based on quality, whether we do a better or a worse quality of care based on somebody's gender, ethnicity, where they are, and what's their socioeconomic status. One of the examples I like right here is equitable. I know that for many, many years we treated female MI patients the exact same way we treated male MI patients. And then they kept dying anyway. They kept dying. It worked for the men, it didn't work for the females. More research showed that women cannot be treated in that same fashion because it does not work for them. One of the biggest things we found out is that we were not even recognizing that women were having MIs on occasion because they present so differently. So finally, having information that is evidence-based can actually help you provide more equitable services. The other thing is on this equitable piece is that, we have some people who have absolutely no health insurance and get no health care at all, and then we have others who have, more insurance than they need. They have more, they go to the hospital, they go to the ER, they go to their doctor, extensively. So that also is an equitable issue that has to be considered. So in patient-centeredness, the real business of healthcare is preventing illness, healing those who are already ill, and then meeting the needs of people who must live their lives with some kind of disability or a chronic disease, and then helping those in our communities to achieve better health when possible. So the patient-centered care includes a respect for the patient's values, preferences, and their expressed needs. It also includes the coordination and integration of care, information, communication, and education, which the biggest component of that is that's nurse-driven. This is case management, care management. Physical support, emotional support, and the involvement of family and friends pulls this into a patient-centeredness. Okay, so our care, our health care, actually needs to be redesigned and improved. And some rules to follow to help make that happen is that care needs to be based on continuous healing relationships. In other words, patients should receive care whenever they need it and in a variety of forms, not just in a face-to-face visit. We have telehealth. We have Skype. We have long-distance EKG monitoring. We have the ability to input vital signs into a computer system, and that automatically talks to the provider very quickly. So there's actually a lot of varieties of ways that we can work with our healthcare relationships with our patients. We need to customize our healthcare based on the patient's needs and values. Our system of care needs to be designed to meet that most common type of needs and still be able to respond to individual patient choices and preferences. So in other words, we need to have a standardization, but we still need to be open and adaptable to how we can make this even more individualized when necessary. We need to remember that the patient should be the source of control. They need to be given the necessary information and the opportunity to choose their health care decisions. They need to be the person who makes the decisions, and they can only do that with appropriate information. One of the issues here is, like, many times a doctor will go in, they'll talk to a person, and they'll have them sign their consent, and then as soon as they leave the floor and the nurse goes in to talk to them, immediately the patient or the patient and family are asking some clarification questions. That means that you know, they really did not ask the physician for clarification. So the responsibility of the nurse is you do not move forward. You actually call the physician and have them return to the patient's room and answer those questions for those patients. There's a shared knowledge. We need a shared knowledge, and we need to have free flow of information, meaning that patients need to have unrestricted, unfettered access to their very own medical information, and then to clinical knowledge that they can use based on that information. Clinicians and patients need to communicate effectively and share that information. And again, we're talking effective communication. We've kind of talked about that already. Evidence-based decision-making is where patients should receive care based on the best available scientific knowledge, not just because it's the way we always do things. It needs to be where we have significant information that supports that care. And then, of course, safety. That is the biggest component of nursing care is safety. Safety as a system property. So patients should be safe from injury caused by their healthcare practitioners or healthcare systems. One of the components to that is the fact that healthcare systems need to make information available to the patients and families. There's a need for transparency. We should not be hiding things from them. They need to have this information to make those informed decisions when they select a health plan, a specific hospital, a specific provider or practice, or even alternative treatments. We need to be able to anticipate their needs. So the healthcare system should actually anticipate those needs rather than simply reacting to events. Now remember, you might have heard me say this in the past. I know my students on main campus have heard me say this, but medical care, medicine is a reactive system. They wait till you have a problem or an illness, and then they take care of that. Nursing is actually the preventative and health promotion component to healthcare. We would rather them not get sick at all. And so now this is what's being pushed in our new healthcare system. And again, continuous decrease in the waste. We need to not waste our resources, the patient's time or any of the healthcare providers' time, because that's, you know, very difficult. That time could be used somewhere else. Those supplies could be used somewhere else and be better benefited than in the landfill. Cooperation among the clinicians and institutions is a way for us to ensure appropriate exchanges of information and coordination of care. So if we do not cooperate and we do not have effective communication, we are not going to get this component done, and we will not be able to completely redesign and improve healthcare because we can't do it without collaborating, so we have to consider that. So one of the things here, you will see many people who are political when it comes to healthcare now, much more than ever in the past. And it seems like that's the way we have to go to be able to make inroads and truly impact our healthcare system to the benefit of the patient. I do like this sign, collaborate or die, because if we don't do that, we will die. If we do not work together and we do not collaborate, we can't do this by ourselves, and we're going to kill ourselves trying to do so. So if we compare health care centered and patient family centered care side by side, we'll see a significant difference. So the way things are currently, the model of patient care has been organized around the needs of the healthcare facility and the healthcare professionals. Traditional methods of patient care delivery very rarely involved the family in any of the medical management. It was the doctor, and they told everybody what needed to be done, and nobody questioned them. Everybody had to hurry up and wait, which is historically what we do now. When you go to a doctor's office, you have to wait on them, and that's still part of why things are as bad as they are. It's still organized around the person that you are going to see, rather than being respectful of your time as much as it is theirs. Now, when we compare the current healthcare to what we want it to look like when it's patient family-centered, this approach is preferred in order to reach high levels of quality care and increasing patient satisfaction. Patient satisfaction is a big component of healthcare and how they perceive whether they were treated well or not, or whether they got good care or not. If you have a patient who's coded like 3 times and you saved their life, they are not going to remember that. But they are going to remember who gave them the back rub, who called their wife for them, who got them the Jell-O that they liked. Those are the things that the family and the patient are going to remember. So we have to keep that in mind. You saving their life, that's you doing your job. Okay? Now, family-centered care encourages a team approach, but a collaborative team where they all work together towards a common goal. There are many aspects of patient and family-centered care where cost efficiency and taking care of people in a simple fashion requires a complete shift in thinking, or a paradigm shift. We need to go from where we are now, hoarding and not being conservative with our supplies and our resources, and being much more efficient, much more conscientious, for us to do a better job. And then, of course, implementing family-centered approach to care is actually an ongoing commitment. It's not something we're going to do and then we're just going to do it once or twice and we're done. This is something that needs to be a commitment that is ongoing. It doesn't stop. Once we start this, this needs to continue indefinitely. So what? What about all this? We have to remember that family-centered care relies upon communication, right? Where all members are involved in the care of the patient. So communication, effective communication. Family-centered care is a multidisciplinary and group endeavor. In other words, the physician will not take care of this patient without having nursing or radiology or lab, okay? Neither will nursing take care of this patient without the physician, radiology, or lab. Radiology and lab can't take care of the patient without them. So we have to recognize that all of us have a significant component of effective care for our patient, okay? Now, we can actually change the schematics of a nursing unit and upgrade it with all kinds of fancy stuff that costs a lot of money wherever you can find it. But the problem is if we just get the fancy equipment and we actually don't improve upon or upgrade how we actually do our practice, we're actually never going to have a positive occurrence towards the good of the patient, for the good of the patient. And that's really what we need to do, is we need to be doing things for the good of or for the benefit of the patient. So that gives us the component of family-centered care. We have one more presentation that we're going to talk about, and it's teamwork and collaboration. So registered nurses have to collaborate with the healthcare consumers, families, and others while we conduct our nursing practice. And collaborate as an action or a verb is actually to work one with another person, to cooperate, especially in a joint effort towards a mutual goal. And then a collaboration as a noun is the actual act of collaborating. So when we are talking about collaboration in nursing practice, we're talking about intra-professional. This is nurse to nurse within the profession. Interprofessional, which means nurse to another profession or between the professions. Transprofessional means across all professions. It's not just one or two, it's actually across all of the professions. And then multi-professional means that we are involving multiple professions, but maybe not all of them, across all of them, okay? We have to consider nurse-patient, family community populations, right? The nurses have to consider the patient. They have to collaborate with the patient. They have to collaborate with the family. They have to collaborate with the community, and they have to communicate with population-specific, actually community-specific type populations. Sorry about that. And then, of course, the nurses have to collaborate with an agency, who they work for. What's the organization? What's the hospital? What's the system, right? So there's something called collaborative reasoning. Now, this is a consensual approach towards the interpretation of examination of findings and then setting the goals and priorities based on that information. Implementation and progression of treatment is used in a consensual approach when you use collaborative reasoning, okay? In other words, it should not be a one-man band here. And if it is a one-man band, it actually should be the patient with the others helping to guide them towards informed decision-making. So that decision-making component, collaborative decision-making, so patients actually have an ethical right to participate in the decision-making that affects their health. Healthcare providers have an ethical responsibility to obtain informed consent. Now, there's a partnership in the decision-making between the nurses, other professionals, patients, families, communities, and populations. So we all need to work together to make good decisions, effective communications, and effective decisions based on the population, the patient, where we are, what's the subject, what's the topic. And we need to do it together rather than in individual silos. So let's look at some common elements, all right? So there should be a desire for all of the participants to work together towards a common purpose or goal. They all reach out and they all believe in doing this same thing, okay? There needs to be a belief that all of the participants are valued, that they are encouraged to have their say, and that their say is important. We need to embrace the unique perspective of all participants. So we need to make sure that not only are we voicing our own opinions, but we're also considering other people's opinions, because they may have a different point of view that you never even thought about using or seeing, okay? The participants actually end up having a very strong sense of purpose when they work in a collaborative team. International trust and shared responsibility amongst the participants means that not just one person is responsible for this, but the entire group is responsible for this being effective. So let's talk about the nursing competencies in collaboration. Okay, so you guys know about the KSAs, right, with the Nurse of the Future competencies. So KSAs, of course, is knowledge, skills, and attitudes. Well, now we're going to look at those competencies in regard to collaboration. So as far as the knowledge component, that's where you are to assess one's collaboration expertise. You know, you need to know what your collaborative expertise level is, and then you need to continue to build that expertise and become better and better at it with more and more experience. And then, of course, the knowledge is that we have to understand the scope and the roles not only of our profession, but other professionals as well. The skills component is, like in communication, we actually need to promote collaboration within our profession, interprofessional, so nurses to nurses to nurses, okay? This needs to be a commitment to lifelong learning and self-development. In other words, you've probably heard this from the day one when you guys were admitted into the nursing program, but this is just the very beginning of your journey. Graduating with your bachelor's degree should not be the end of where you're going. Even if you don't go back to university and get a further degree, you still cannot just be done. Healthcare changes too quickly, too rapidly. Too much evidence comes out, things that are noted or found out or whatever. You need to stay on top of those things. More new equipment comes out. Maybe this is an alternative therapy that's actually very effective, and we never thought about using it in a specific situation, and the research has shown that it's actually the alternative method of choice to address the patient. When we're talking about attitudes, our attitude should be that we are actually respectful of the healthcare consumer, meaning the patient, and that should be central to that entire collaborative process. We also need to be committed to conflict management and conflict engagement. In other words, we need to be able to have crucial conversations professionally, and we need to be able to manage our differences respectfully, and then still be able to engage in effective communication and effective work with each other. So that actually concludes our presentation on the last three components. So this is communication, which is number 8, I believe, and patient-centered care, topic 9, as well as teamwork collaboration, topic 10. And so these are the last of the topics for exam 3 in Nursing 421. Again, this is Professor Land, and I am very glad to have had you join me. And please do not hesitate to reach out to your faculty. We are all here for your benefit. And let us know if you have questions or you need clarification about any of their topics. Thank you and good night.